So point number one is that if you don't enroll in Medicare on time, you're going to face a penalty. And that penalty will be ongoing throughout the rest of your retirement. So we'll talk about that in more depth relevant to when to apply for Medicare and how that works. Our second key point is if you do not get the right private health insurance to go along with your Medicare to help you pay such things as deductibles and out-of-pocket costs, then you could possibly be paying too much either in premiums or paying too much in those out-of-pocket costs. So you want to be aware of getting the right insurance to go along with your Medicare. So most people are even surprised to know that you may even need a private health insurance to go along with Medicare. And then our third point is if you don't plan for these higher healthcare costs in retirement, you could ultimately run out of money because of poor planning. So you do need to try to plan for that, be aware of what your situation may unfold, and you want to be particularly aware of your current health conditions, as well as what health conditions might crop up in the future. So we'll go through our agenda, kind of looking at each part separately, and then we'll ultimately get into each one of those parts. So when we talk about Medicare enrollment, we're going to discuss, what is Medicare itself, who needs to enroll in Medicare and when, and then how do you actually enroll in Medicare. So there's various ways as far as enrolling in Medicare. There's various ways as far as how to pay for Medicare, and we'll talk about those different aspects. So part two of the class, we'll talk about Medicare and the private insurance, what things Medicare does cover, what costs those are, how, what Medicare doesn't cover, and then how does private insurance work with Medicare in trying to cover some of those costs that Medicare may not cover. And then a third part of the class, we're going to talk about reasons why your healthcare expenses will potentially be higher in the future. So the two main reasons are because of inflation. So we've seen healthcare dramatically rise in the last, let's say, 4 to 5 years, even the last decade. So healthcare continues to increase pretty dramatically just because of inflation, as well as the older you get, you'll probably have an increased need for services that you may have not had in the past. And then lastly, we'll talk about Medicare not covering the need for long-term care if that were to be the case. So again, many people are surprised to find out that, costs for some of these services are not really covered by Medicare. So as we get into Medicare enrollment, so that you have a good understanding of when you need to enroll. So primarily, we'll kind of look at who pays for healthcare in the United States. So before age 65, typically if you're employed, your employer group health insurance is going to provide you with that coverage. If you're a retiree before the age of 65, you may have retiree health insurance. If for some reason you're in between jobs or you've left an employer, you might be eligible for what's called COBRA. So that's a plan where you could stay on your existing health insurance through your employer. However, you would have to pay for that coverage. Then there's also individual health insurance that you could buy in the marketplace. Again, if you're under age 65, and then other sources, which could potentially provide you with health insurance as well. But then after age 65, Medicare becomes the primary payer and generally pays first for any health care needs. So the only exception to this is if you're continuing to work and you work for an employer that has a group plan and that covers 20 or more employees. Or if your spouse is still working and your spouse is covered and you're covered on their plan with that group as well. And typically, your other insurance, so whatever other insurance you have, is going to pay secondarily. And we'll get into more details as far as, if you are part of that employer group that covers 20 or more people, how that would actually work in your situation. So what this basically means is that unless you are covered by that employer group plan that covers 20 or more employees, you must enroll for Medicare when you turn age 65. There's really not an option, and that's why you see this kind of warning sign at the top of this page. So what if you don't enroll in Medicare? So if you don't enroll in Medicare on time, you're going to pay a late enrollment penalty. And those penalties can be as high as 10% for each year that you fail to enroll. Your healthcare expenses may not be covered by insurance, and your private insurance options might be limited. So they might be limited in the sense that, if you're in poor health or you have any pre-existing conditions, private insurance that coordinates with Medicare, they have to take you if you sign up for Medicare during your enrollment period. And we'll talk about these different enrollment periods. But if you don't, they can deny you or they can charge you much higher premiums. So again, it's advantageous to make sure that you're signing up and enrolling for Medicare on time and doing it appropriately. So Medicare is basically a national health insurance program, and it's for people that are age 65 and greater. It's administered by the Centers for Medicare and Medicaid Services, and you primarily are going to enroll through the Social Security Administration. Okay. So Medicare was put into place in 1965 by President Johnson, and it's been in place since that point. So if you're over the age of 65, you're eligible. All US citizens are eligible for Medicare. We'll talk about that a little bit more in detail as we get further into the class. Legal residents who have lived in the United States continuously for at least 5 years. And then some people who are under the age of 65 that might be eligible for Social Security disability benefits. But we're not going to focus on that part of the Medicare eligibility. We're going to primarily focus on the eligibility for people that are over 65 and that are retired. So there are 4 parts to Medicare. There's Medicare Part A, which primarily covers hospital insurance. So if you are in the hospital, you need to stay in the hospital. You're having some type of, let's say, maybe major surgery that's not considered as outpatient surgery, then Medicare Part A would cover those types of expenses. And then Part B covers the cost of medical services such as doctor visits, various procedures or diagnostic tests that are not part of a hospital stay. They might just be an outpatient type scenario. And then Medicare Part C is really what's called a Medicare Advantage plan. And we'll talk a little bit more in detail about Medicare Advantage and how that works. It basically is combining Parts A, Part B, and then ultimately Part D, which is the Medicare prescription drug coverage. So Parts C and Parts D are actually provided by private insurance that contracts through Medicare. It's not provided directly through Medicare, and we'll talk a little bit more in detail about that. Okay, so just remember that there are these 4 parts to Medicare. So you really have 2 options when you're signing up, or when you're looking at Medicare. So the first option is you would have the original Medicare, which would consist of Medicare Part A, Medicare Part B, and then Medicare Part D. And then you can also add what's called a Medigap policy, or a Medicare supplement insurance, which helps you to pay for the out-of-pocket cost and copays and deductibles that Medicare does not pay for. And then the second way is you can sign up for the Medicare Advantage plans, which are considered Part C, and those are all encompassing. So they include Part A, Part B, and Part D. So they act more like an HMO or a PPO, where you may be limited as far as the various doctors and choices that you have. So it's important to understand your current medical status, how you feel about that, because potentially switching between the 2 options may not be available at certain points in time. So how you enroll is, if you are currently receiving Social Security when you turn 65, Medicare Parts A and Part B are automatic unless you decline those. So if you're receiving Social Security, they're going to automatically sign you up for that. The coverage would start on the first month that you turn 65. And then Part C and Parts D are not automatic. You have to choose a private insurance for that and proactively enroll in those coverages. So those are not automatically, and you'll typically want to enroll sometime before your 65th birthday. You can actually enroll 3 months before you turn 65 and all the way to 3 months after you turn 65 to be in what's called that initial enrollment period. So if you're not receiving Social Security benefits, and when you turn 65, you still must sign up through the Social Security Administration during a Medicare open enrollment period. So these are the various open enrollment periods. The first one is called your initial enrollment. So this is where if you're not covered by a group plan at age 65, that would be an initial enrollment. The special enrollment period is if you are covered by a group plan that covers 20 or more employees at age 65, then there's a special enrollment period for that. And then the general enrollment period is if you happen to have missed either one of the other 2, then you have to go into this general enrollment period, of which we'll discuss in a moment during the class. So your coverage would start basically, when you sign up. So for example, if you sign up the month before you turn age 65, the coverage is going to start the month you do turn age 65. If you sign up during the month that you turn 65, it's going to start the following month. So again, it's pretty important that if you do want that coverage to start when you turn 65, that you sign up before you actually turn 65. And if you sign up, a month after that or 2 or 3 months after, it's always going to follow the month after that you sign up. So again, you can sign up 3 months before, you can sign up the month of that you turn 65, and even 3 months after that to fall into that initial enrollment period. So this goes into a little bit more detail under the initial enrollment period. So this is basically for everyone who turns age 65. So you would want to check with your benefits administrator if you're still working and covered by a large plan, because even your large plans or large employer plans may still want you to sign up for Part A. You may be advised to enroll in Medicare Part A to enhance the hospitalization coverage, that's even currently offered by your employer. However, you may not want to sign up for Part A if your employer plan that covers 20 or more employees has a high deductible health insurance plan paired with a health savings account. Because if you want to keep your health savings account and you sign up for Medicare, you would have to stop your contributions to the health savings account because Medicare is not considered a high deductible plan. So again, I always caution people, if you are working for a company that has 20 or more employees and they have health insurance and you're beyond the age of 65, you always want to check with the benefits administrator to see what their requirements are. Don't take this lightly, because you could fall under a category where, let's say you just assume that this coverage is going to take precedent, and you don't sign up for Medicare Part A. That may not be the case. So you always want to default to contacting the benefits administrator and making sure that you're doing this appropriately. So for Part B, again, people who are not covered by a comprehensive employer plan that covers 20 or more employees when they turn 65, you have to sign up for Part B if you want to have that coverage. So you're not working, let's say you're self-employed, you're employed by a company with less than 20 employees, you're currently on COBRA, you might be receiving retiree health benefits. So even if you're receiving retiree health benefits, so once you retire, your retiree health benefits become secondary to Medicare. So just remember that, once you're retired, that even if you have retiree health benefits, those benefits are going to be secondary to Medicare. Okay? So, and if you're employed by a company that you feel that their health plan's not really that comprehensive or not really that good, you may want to sign up for Medicare because it's typically pretty good coverage. It's pretty comprehensive. And then Part D, the prescription drug plan, people have signed up for Parts A and B and want prescription drug coverage, whether now or in the future. They have to sign up when first eligible, or again, you would face a late enrollment penalty unless you're covered by a plan with drug coverage at work. So, Medicare would classify that as credible coverage. So there's two options. One is the standalone prescription drug plan that would go with original Medicare Parts A and B. And then the second option is the Medicare Advantage plan that would potentially include the drug coverage with that. And the late enrollment penalty for not signing up for Part D, it's 1% per month if you fail to sign up within 60 days of needing that coverage. Okay, so it's 1% per month or 12% per year, whatever the case might be. So we'll talk about this special enrollment people. So this is for people who did not sign up for Parts B and D during their initial enrollment. So they didn't sign up because they were covered as a worker or a spouse of a current worker by a large company, which is 20 or greater employees, and they have that group plan. So if you're employed by that, again, you didn't have to sign up But now let's say you're retired, you now have this special enrollment period for Part B. So it basically any time before your coverage ends, and you have an 8-month period starting the month that your group coverage ends. But you may not necessarily want to go that 8-month period because you would be without coverage for that 8-month period. So it's the special enrollment period for Part D is again anytime before the coverage ends, and you want to do that within 63 days after the coverage ends. Otherwise, you would face that penalty of that 1% per month as well. And the penalty for Part B would be that 10% penalty per year if you didn't sign up within that 8-month period. So the best time to enroll in Medicare to avoid any of these late penalties is obviously signing up during the initial or special enrollment periods, as well as you want to try to avoid gaps in coverage. So you want to definitely sign up before any of your coverages would end. So the general enrollment period is for people who have missed the initial enrollment period or who have missed that special enrollment period. So the general enrollment period is every January 1st through March 31st. And the coverage would start the month after you enroll. So, if you sign up in January, the coverage would start in February and so on. Okay. So just a quick review of these enrollment periods. The initial enrollment period is basically for everyone who turns age 65 that's not covered by an employer plan, or if you aren't covered by an employer plan of greater than 20 people. So the best time to sign up is 3 months before your 65th birthday. This way, coverage is going to start the first of the month that you turn age 65. The special enrollment period is for people over the age of 65 who are a current worker that work at a large company of greater than or equal to 20 employees. And the best time to sign up here is again before your coverage ends, so that coverage could start on the first month that you would need that coverage. And then general enrollment is for everyone over the age of 65 who missed that initial enrollment period, and that runs January through March 31st each year. So again, this is a website as far as how you might sign up for Medicare. You're going to go to the Social Security website, www.ssa.gov, and apply for Medicare benefits. You could call as well, but typically if you're astute enough to go on the computer, it's much easier to just sign up online and do it that way. Signing up for Medicare Part D is a little bit different because you're not signing up through Medicare itself. Medicare Part D, you have to sign up through an insurer. So a private insurance company, you would contact them and apply through that service. Or you can apply through Medicare Part C, where you have an Advantage plan, which Medicare Part D would be part of. Okay, so our second part, talking about Medicare and private insurance, how these two coexist, how they work together. So we'll get into talking about that. So the premiums, these out-of-pocket costs paid by Medicare beneficiaries. So if you're considered on Medicare, you're considered a Medicare beneficiary. So you're responsible to pay the premiums for Medicare Part B, which would be paid directly to Medicare. If you have private, you may have private insurance premiums for Medicare Part B, or if you have a Medigap policy or a Medicare Advantage plan. Okay, so these Medigap policies, which we'll talk a little bit more in detail later, those have a premium as well. The other out-of-pocket costs that you may have are the deductibles, portion of doctor bills that are not paid by Medicare, or services that are not covered by Medicare. So the monthly premiums, as far as what you would pay, so Medicare Part A is generally free or no cost. So this is as long as if you or your spouse has paid into Social Security for 40 quarters or more, basically 10 years. So if you've worked in a job and you've had Social Security and you've worked there for 10 years or more, you would not have to pay for Part A. However, if you haven't worked and paid into Social Security and for less than 40 quarters, somewhere between 30 and 39, your premium would be $285 per month. And if you worked for less than 30 quarters, then your premium would be $518 per month. And then Medicare Part B, this is a premium that everyone generally pays, would be $185 per month, and that's the premium in the current year of 2025. Plus, any income related monthly adjustment amounts, and we'll talk about that in a moment as well. So if your income is greater than certain amounts, Medicare charges a higher premium to you for that. And then the Part D, that's paid to the private insurance company, and that can vary based upon the current plan that you have. And we'll get into a little bit more details as far as determining what kind of plan might be the best for you in that section. So this chart goes over what's called this income-related monthly adjustment amounts. So you can see these various columns. It talks about your modified adjusted gross income. So if you're single and if your income is less than $106,000, you would pay the normal $185 premium. The same goes for if you're married filing jointly. Then if your income is less than $212,000, you still pay the $185 premium. Okay. So now if your income increases, so let's say now you're a married couple and your income is over $266,000, and then your Medicare premium, as you can see in the columns beyond here, so you would be paying the normal $185 plus an additional $185 because of your income limits, and then an additional $35.30 for Medicare Part D. So your total Medicare premium would be $405.30 compared to just paying $185. So again, making sure or looking at your income and making sure that you're maybe not inadvertently causing your income to go above certain levels to increase your Medicare premiums. Because as you can see in the chart, so again, for example, if I'm married filing jointly and my income is $266,000, but if I just go over that by $1, my premium dramatically increases, right? So my premium would increase from $272.70 all the way up to $405.30 just because I went into that other bracket by $1. So again, it's pretty important to try to manage your income relevant to kind of looking at this aspect. So these are the deductibles relevant to Medicare. So your Part A deductible is $1,667. So that's per spell of illness. And then your Part B deductible is $257 per year. And the Medicare Part D deductible is $590 per year. So those are the deductibles that you would have to pay out of pocket. And a lot of times your Medigap policy will cover these deductibles. So as we get into the Medigap policies, we'll see and kind of show you what those would look like. So along with the deductibles, you may also have, or you will have co-insurance. So hospital stays are $419 for days 61 through 90. That would be your copay. Days 91 through 150, the copay would be $838 per day. And then skilled nursing care would be $209.50 for days 21 through 100. Okay, so again, these are the co-insurance, which again, some of your Medicare or Medigap policies may cover a lot of these co-insurance costs. And then the Medicare Part B, so there's a 20% copay for Medicare approved rate coverages. And then unassigned claims, there's a 20% plus an additional 15 potential charge if the doctors will charge more over that Medicare approved cost. So various aspects as far as the co-insurances in looking at that. So Medicare Part D, the prescription drug plan, this is kind of looking at the $590 deductible. And then there's a 25% cost of the drugs after the deductible has been paid. And then no further cost for covered drugs once out-of-pocket spending has reached $2,000. So previous to 2025, there was what was called a donut window that you may have fallen in, but the Inflation Reduction Act, which was passed last year, actually did away with that. So now, starting this year, there is no additional coverages. There's no donut hole that people have to worry about going into, okay? So you always want to make sure that you're picking a plan that covers the drugs that you take. So these various drug plans are, they can vary pretty widely. I always encourage people to talk to their pharmacist and ask them what Medicare Part D plan do they think would be the best for them. Because the pharmacist is pretty knowledgeable about those plans, and they're also knowledgeable about the types of drugs that you're currently taking. Okay. So what does Medicare cover? We'll talk about that. So Medicare is going to cover 100% of the first 60 days that you're in the hospital. And as you saw prior to that, there were those co-insurance premiums or co-insurance payments. Medical services such as doctor visits, outpatient services, Medicare is going to pay 80% of the Medicare approved amount, and then you're responsible for that other 20%, or your Medigap policy may pick that up. Medicare will also cover some preventative services such as flu shots, certain type of screenings, various aspects like that. Okay. So these are things that Medicare does not cover. So they don't cover long-term care. They're not going to cover delivered outside of the United States. So care delivered outside of the United States is not covered by Medicare. However, certain Medigap policies will cover those costs. Dental, vision, hearing aids, cosmetic surgery, acupuncture, so various different types of procedures, they don't cover those as well. So amounts over the Medicare approved amount, they're not going to cover that as well. And amounts not covered by deductibles and coinsurance, such as that 20%. So private insurance, or these Medigap policies, right, they may cover all of it or part of it. So deductibles and coinsurance amounts, such as the Medicare Part A deductible, the hospital cost after 60 days, 20% of doctor bills that Medicare doesn't pay, and amounts that doctor charges over the Medicare approved amount. Prescription drugs, the deductible, they may cover that. Most of the costs of certain drugs during the initial benefit period, and then any catastrophic periods as well. So Medigap policies are, again, provided through private health insurance for individuals. They're sold by private insurance companies. They're a supplement to the original Medicare coverage A and B, and they follow federal and state laws to protect you. So they follow these federal and state laws by making sure that they're standardized type policies. So what I mean by that is that they're easily identifiable. They're standardized in all states except for Massachusetts, Minnesota, and Wisconsin. They kind of standardize their plans differently. They don't work with Medicare Advantage plans, so Medicare Advantage is completely different. And then you pay a monthly premium for the Medigap policy. And those costs can vary by the different plans that are available. So this is a chart that goes over the Medigap benefits, the various policies. So the policies are labeled A through N, and they're all standardized in far as what they cover. So for example, one of the most comprehensive plans is Plan G. So if you were to purchase a Plan G policy, you know that the various things, such as, let's say, Medicare Part A coinsurance and hospital costs, up to an additional 365 days after Medicare benefits are used up, that's 100% covered under Plan G, okay? As well as, let's say the cost of skilled nursing facility, the coinsurance. And again, that's only up to that 100-day level. After that 100-day level, those Medigap policies would not cover. And then if you look at things like your Medicare Part A deductible, and so on and so forth. So again, easy to understand, easy to look at, so you can compare the various plans. So for example, if you compare a Medigap plan from company ABC to company XYZ, and you were comparing Plan G, you know that all of the coverages would be the same, and then that would give you a good idea as far as comparing based upon what the cost might be for those plans. And then the Medicare Advantage plans. So this is a health plan option which is approved by Medicare. It's called Medicare Part C. It's run by private insurance companies. So what happens here is that Medicare pays an amount for each member's care. So Medicare pays the insurance companies. And then you may have to use a network of doctors or hospitals versus being eligible to use any doctor that you may want. And the plan may include a prescription drug plan. It may include extra benefits like vision and dental. And the benefits and cost sharing may be different from one plan to another. Okay. So Medigap policies are standardized, but the premiums can vary. You can choose between those various plans, plan A through plan N. You want to definitely choose a reputable company that's going to offer these policies, potentially at the lowest price, and make sure your healthcare provider processes the billing for your company that you choose, right? You don't want to have to be submitting bills and getting reimbursed. You want a company that's going to process those billing and those payments for you. The drug plan benefits vary considerably. So again, choose a plan that's going to meet your needs. It's going to cover the medications that you take. And Medicare Advantage, so those vary pretty considerably. So you want to make sure you're aware of all the benefits that plan covers before you sign up for a specific Medicare Advantage plan. So you need to kind of outweigh the pros and cons of the Medigap policies versus the Medicare Advantage. So part 3, we're going to talk about planning for these higher healthcare costs in retirement, what you might want to potentially expect. So if we look at the typical Medicare budget, right? So if somebody's going to be on typical Medicare, the Part B premium is $185 per month. A typical Medigap premium would be on average about $200 per month. Part D drug plan premium would be about $40 a month. So your total out-of-pocket cost for these coverages or your Medigap policies would be roughly about $425, counting Part B as well as Medigap. So if we looked at that on an annual basis, right, that's $5,100 per year. Your prescription drug cost may cost you $650. Let's say dental, another $450, vision, another $300, and then alternative care out of pocket is $200. So, your total out of pocket cost could be potentially or somewhere in the range of, $6,700 or even more per year. So you want to definitely plan that as you're thinking about retirement, especially, if a lot of your healthcare costs are covered through your employer plan. You may not be paying this, close to $500 or $600 per month, whereas your employer may be picking up a lot of that cost. So we talked about this earlier, what can cause the healthcare budget to become higher. So just higher insurance premiums, higher out-of-pocket costs, things that aren't covered by Medicare or your Medigap policies, things that aren't covered such as your dental, your vision, hearing, things like long-term care. Or if you happen to need an expensive prescription drug that may not be covered by your prescription drug plan or may not be covered by Medicare as well. So those various aspects. So these are some statistics. So this is, according to these various sources such as Fidelity, the Employee Benefit Research Institute. So you can see the average healthcare cost over someone's retirement. So for a couple, it could be as high as $330,000. For men, $184,000. For women, potentially $217,000. So for women, the cost is typically higher because women tend to live longer than men. So their healthcare expenses may be potentially higher. So planning for long-term care. So long-term care is not covered by Medicare or Medigap. Skilled nursing, there's no coverage after the 100 days. So again, Medicare is going to help provide coverage for that first 100 days, but after 100 days, that goes away. And then that, basically talks about or helps with the activities of daily living. There's typically no coverages at all for that. So we'll talk about these various levels of care when we talk about long-term care. So typically most people start off in level 1, which is in-home assistance. So if a person needs help with these what are called instrumental activities of daily living, things like shopping or preparing food, housework, managing money, traveling locally, using a telephone, responding to emergency alerts. So those are considered instrumental activities of daily care. So you may need some in-home assistance. Level 2 is the next level up, considered custodial care. This is where you need help with these activities of what are called the activities of daily living, things like eating, bathing, dressing, toileting, transferring, maintaining continence. So, you may not need full-blown care, but you need help with typically at least 2 of these 6 activities of daily living. And then level 3 is skilled nursing. So this is where you need 24-hour supervision. It's ordered by a physician. There's disease management. There's rehabilitative services. So this is, the highest level of care where you have that 24-hour nurse on staff. You have, there's physicians on staff periodically as well. So these are the typical cost of long-term care services. So homemaker services, across the country, they average about $190 per day. Home health aid of roughly about $207 per day. Adult daycare, assisted living, semi-private room, or even a private room. So you can see as you move up that ladder, these expenses continue to be higher and higher throughout time. So why would you want to plan for long-term care? The primary reasons is that, you want to spare your family members the burden of trying to care for you. Sometimes people will say, well, my daughter is going to take care of me, or my son will take care of me. But is that really a reality that, are they going to be able to quit their job to take care of you? Is that something that you want to, have your children doing, or kind of burdening your children with that responsibility? So avoiding to have to spend down your assets to go on Medicaid, which would be the case. So if you don't plan for the long-term care, you'd have to spend down your assets prior to becoming eligible for Medicaid. So Medicaid is different than Medicare in the sense that Medicaid is the plan that helps people that are impoverished. So you want to be able to direct your own health care. You want to be able to be independent, make sure that you stay independent throughout your life. So kind of wrapping things up, kind of look at these 3 reminders relevant to the class. So the first reminder is make sure that you enroll in Medicare on time. You want to shop for private insurance carefully, right? You want to make sure that you got a good Medigap policy or a good Medicare Advantage plan, something that's going to meet your needs and relevant to looking at those needs, potentially at 65 or even before age 65. And then the third, which we talked about, plan for higher healthcare costs in retirement. So if you're not used to paying for any healthcare costs, most of those costs are provided through your employer, then you want to be aware of those costs. So I appreciate your attendance. I appreciate you coming to the class. As always, we enjoy having you, and we want to thank you again for your participation, being part of Canella Financial Group, and attending our classes. So thank you again.